You wake up with a terrible headache today, and you just swallow a tiny white pill. You drink a glass of water, lie down, and within 30 minutes, you feel completely fine. But for almost the entirety of human history, that simple white pill simply did not exist. Getting sick meant rolling the dice with the absolute most terrifying medical treatments anyone could imagine. Let's dive straight into the absolute craziest ways ancient humans desperately tried to cure their illnesses. Number 5. Drilling massive holes straight into your actual skull while you are kept completely awake. It is widely known as trepanation, and it remains the oldest surgical procedure we have ever found. Thousands of years ago, ancient doctors truly believed that your headaches were caused by trapped demons. Their brilliant medical solution? Take an incredibly sharp stone tool and aggressively scrape your skull bone. They would literally carve a giant physical hole right through the bone to let evil escape. There was absolutely no anesthesia, no sterile environment, just you, a rock, an unimaginable blinding pain, and the most shockingly disturbing part? Archaeologists have found thousands of these ancient, heavily carved skulls. Many of them show obvious signs of bone healing, meaning people actually survived this brutal procedure. They literally walked around for years with a giant open hole exposing their bare human brain. Number 4. If you happen to live in ancient Egypt, your doctor might prescribe animal dung. You heard that completely correctly. Ancient Egyptian medical professionals used literal animal waste to cure diseases. Got a really nasty, painful burn? Just rub some fresh frog and donkey dung right onto it. Suffering from a terrible eye infection? A nice thick paste of crocodile dung should quickly fix that. They foolishly believed the incredibly foul smell would successfully drive away the evil spirits causing sickness. Of course, rubbing bacteria-filled animal waste into open wounds inevitably caused massive, highly deadly bacterial infections. But if the unfortunate patient died, the doctors simply blamed it on a very stubborn demon. Number 3. The historical, absolute obsession with purposefully draining the human body of its vital lifeblood. For 2,000 agonizing years, the smartest doctors on earth firmly believed in the 4 humors. They genuinely thought your body was filled with blood, phlegm, yellow bile, and dark black bile. If you unfortunately got sick, it clearly just meant you had way too much human blood. So, the local town barber would happily take a sharp blade and slice your veins wide open. They would literally drain your precious blood into a large bowl until you passed completely out. Do you have a severe fever? Drain the blood. Have a mild stomachache? Drain even more out. When cutting patients became far too messy, they eagerly turned to nature's tiny vampires, the leeches. They would tightly attach dozens of hungry, slimy, blood-sucking leeches directly to a sick patient's bare skin. During the 19th century, the country of France was importing 40 million leeches every single year. President George Washington literally died because his doctors drained half his blood to cure a throat infection. Number 2. Casually eating dead human bodies to cure your everyday annoying aches and mild pains. Welcome to the horror of corpse medicine, a totally normal practice for European royals and wealthy elites. In the 16th century, upper-class Europeans became absolutely, undeniably obsessed with consuming pulverized ancient Egyptian mummies. Desperate grave robbers would aggressively steal mummies, grind them into fine powder, and sell them as medicine. Got a terribly persistent cough? Just swallow some pulverized, 3,000-year-old, allegedly cursed ancient Egyptian pharaoh dust. The market got so incredibly bad, the greedy merchants started faking mummies using the bodies of criminals. But it certainly wasn't just mummies. King Charles II actively drank liquid human skull extracts. People wildly believed that by consuming a strong, healthy human corpse, you would magically absorb its vitality. brutal executioners would literally sell expensive cups of fresh, warm blood straight from the wooden chopping block. Desperate epileptics would constantly stand by the guillotine, waiting to drink the fresh blood of the condemned. Just try to imagine going to your local neighborhood pharmacy to casually pick up ground human skull. Number 1. The terrifying medical horror that literally happened less than 100 short years ago today. You might reasonably think these crazy treatments were only reserved for cavemen and medieval plague doctors. But the infamous lobotomy was highly celebrated as a miraculous medical breakthrough in the 1940s. If you suffered from severe depression or anxiety, a doctor would confidently say they could fix it. But their chosen method is straight out of the most terrifying, unhinged psychological horror movie ever made. A prominent doctor named Walter Freeman invented a sharp tool that looked exactly like an ice pick. He would forcefully slide this sharp metal spike right past the sick patient's actual blinking eyeball. He would aggressively hammer it right through the incredibly thin bone at the back of the eye socket. Then, he would violently swish the metal spike back and forth inside the patient's delicate frontal lobe. He was quite literally scrambling the crucial front part of the living human brain like a breakfast egg. Terrified patients were completely awake for this. They typically only received local numbing drops for their eyes. Freeman routinely performed this brutal 10-minute brain surgery in his regular office, completely lacking basic surgical masks. Did it actually successfully cure their crippling anxiety? Sure, by turning them into completely empty human shells. They entirely forgot how to speak, how to feed themselves, and who their own family members were. Yet this arrogant man confidently traveled the country in a van, performing thousands of these irreversible surgeries. He shockingly even performed this horrific brain-scrambling procedure on entirely healthy children who were simply just misbehaving. The original inventor of the lobotomy actually received a prestigious Nobel Prize for this absolute nightmare procedure. It notoriously took several long decades before the medical community finally realized how purely monstrous it was. Now, let's take a step back and deeply think about how completely wild this all truly is. Every single one of these deeply insane treatments was confidently performed by the greatest experts of their time. The absolute smartest people alive confidently looked at a very sick person and decided to grab a drill, or a bloodthirsty leech, or a cursed jar of mummy dust, or a literal sharp metal ice pick. They truly, deeply believed they were helping, bravely pushing the absolute boundaries of our human medical science. And vulnerable patients inherently trusted them, completely submitting their fragile bodies to these agonizing and deadly procedures. It ultimately proves that human desperation to survive will actively make us endure almost any nightmare imaginable. When you are genuinely facing imminent death, drinking human blood or letting leeches bite seems perfectly reasonable. It honestly makes you profoundly wonder what specific modern medical treatments will look completely insane in the future. In 500 years, will future human beings look back at our hospital surgeries in pure horror? Will they hysterically laugh that we aggressively pumped highly toxic chemicals into human bodies to combat cancer cells? Will they logically think slicing people open with cold steel scalpels was horribly barbaric and wildly primitive? History constantly tells us that today's celebrated medical miracles always inevitably become tomorrow's absolute terrifying historical nightmares. But for right now, we should just be incredibly grateful for the modern medical world we inherited. You thankfully never have to actively worry about a town barber draining half of your essential blood supply. You absolutely do not have to rub fresh donkey waste on a painful scrape you got at work. You will fortunately never be told that your severe migraines require a very quick cranial drilling session. We successfully traded cursed magic potions and crushed mummy dust for reliable antibiotics, vaccines, and sterile modern hospitals. We easily survive minor infections that violently wiped out entire ancient cities and completely erased family bloodlines. We are undeniably the absolute luckiest generation to ever safely exist in the entire brutal history of humanity. So the very next time you are quietly sitting in a bright hospital waiting room, feeling slightly annoyed, simply because the trained doctor is actively running maybe 10 or 15 minutes behind their regular daily schedule, just take a very deep breath, calmly look around the incredibly clean room, and count your endless blessings. Because at the very least, they strictly aren't eagerly coming through that door, holding a giant jar of hungry leeches.